Welcome to the press briefing for COVID-19. On stage, we have Dr. Choi Tak-kin, Undersecretary for Food and Health, Dr. Albert Au, Principal Medical and Health Officer of the Communicable Disease Branch of the CHP, and also Dr. Larry Lee, Chief Manager of Hospital Authority. Dr. Choi. Good afternoon, everyone. As at yesterday, i.e. the 2nd of March, we had already recorded over 218,000 cases of COVID in the fifth outbreak. Since the start of the fifth outbreak, over 920 persons have died of COVID. The Department of Health has analyzed the first 527 deaths from COVID, and our conclusion is over 91% of them have not received 2 doses of vaccine. Vaccination is highly effective in preventing serious conditions and even death. And in this round of outbreak, the elderly and children are more affected, and it's most urgent for these 2 groups to be vaccinated. The government has, through various means, make it more convenient for them to be vaccinated, and is preparing to set up community vaccination centers for CoronaVac for children, adolescents, and the elderly. Now we will continue our risk-based testing strategy so as to achieve early detection, early isolation, and early treatment. As for early identification, we'll continue to provide pre-testing services for specific high-exposure groups, and we will continue to have our community testing centers and mobile testing stations to provide free testing services for people who volunteer to be tested, and we'll continue to target put high-risk buildings under our R&T operations. With the strong support of the central government, the SL government has purchased a large volume of RAT kits. And at different locations of Hong Kong, we are giving out free kits. To areas that return positive under the sewage surveillance scheme, and to cleansing workers, and also property management staff. And as for treatment, we will continue to collaborate with the Chinese medicine sector and hospital authority and to use the strength of Chinese medicine in treatment and prevention. With the strong support of the central government, we've been able to coordinate for Chinese proprietary medicine to arrive in Hong Kong. So far, 3 types of such medicine have arrived in Hong Kong, and they are Nianhua Qing Wen Jiao Nang, Jinhua Qinggan Keli, and Huaxiang Zhengqi. And we are now giving out these proprietary medicine to different people, to those in need through different channels, through community organizations, and we're also giving them to people who are in community isolation facilities and also residents who are under RT and operations in the past few days. And we're also asking our Chinese medicine clinical and treatment and research centers in all 18 districts to distribute such medicine. Now, the pandemic is really serious, and our healthcare and public services system are under unprecedented challenges. According to the Department of Health, among the confirmed cases, the ratio of symptomatic and asymptomatic cases are in the ratio of 2 to 1, and according to research overseas, a larger proportion of patients are suffering from the Omicron variant do not have any symptoms, and therefore Omicron is more transmissible in community. So I urge members not to go out unnecessarily and avoid cross-family gatherings, and please observe anti-epidemic measures. Now I'd like to talk about the supply of food. Recently, we have seen an increased demand for food and also panic buying. As the chief executive has said a number of times, and also press releases by the government, our supply of fresh produce is stable, and there is no need for panic buying. In fact, the central government has stressed time and again that there should be adequate supply of food to Hong Kong, and the Guangdong province and the Shandong municipality have coordinated with our government, and we have now a few new routes of transport by rail and by sea, and also enhance our land transportation route to ensure stable supply of vegetables, fruit, and daily necessities. They will be supplied to Hong Kong continuously. As of yesterday, now the amount of vegetables and chilled poultry arriving in Hong Kong have restored to the normal level. There were over 2,400 tons of vegetables, 160,000 chilled poultry, and there was a record high import of chilled pork, and the supply was 1.9 times of our normal level. As for the Shanghai slaughterhouse, thanks to the assistance from skilled workers from the mainland, the slaughterhouse is now preparing to resume business as soon as possible, and the Chinwan slaughterhouse will resume service when situation permits. Now, according to the industry, we have enough stock of rice to last for 1 month for the whole territory, and 3 months of frozen meat for the whole of Hong Kong. And we have also communicated with major supermarket chains, and they will deploy enough manpower to refill shelves and to ensure supply of goods. To put it simply, we will have a continuous supply of food produce, and there is no need to hoard. Now, while we are at the height of the epidemic, we must unite, and with the support of the government and also staunch support of the government, we can win in this 5th wave.
Good afternoon, members of the public and media friends. I'm now going to report the number of cases reported yesterday. Yesterday, 56,827 cases were reported, including 5,434 cases confirmed in the HA, and 2,602 cases reported and confirmed by the public services laboratory. The remaining 48,791 cases were confirmed by private laboratories. Only 2 cases were imported. 56,825 cases were locally imported. During the 5th wave, the accumulated infection number is 337,926 cases. In terms of gene analysis, yesterday we have performed a genome sequencing for 2,602 samples. We have not discovered any samples with L452R strain. 1,724 cases were tested negative to L452R strains, it means that they are probably Omicron cases. 465 cases are still pending, and 413 samples are unconfirmatory because of the low viral load. In terms of care homes and hospitals, yesterday an additional 37 care homes have seen infection, including 21 RCHEs and 16 residential care homes for persons with disabilities, involving 566 cases. 434 cases are residents and 132 cases are staff members. The care homes distribution, 3 in Hong Kong Island, 5 in Kowloon, 14 in Kowloon East, and 15 in New Territory West, or 14 in New Territories East. So far, some 710 care homes have been infected in this wave, involving altogether 4,100 residents and some 1,300 staff members. Now, on the 26th of December, the FEHB issued a press release on the discharge condition, or the condition for ending quarantine for confirmed patients and close contacts at home. Now, I would like to make a supplement because there are many inquiries and questions about the condition. Now, for a person tested positive on a PCR test or a RAT kit, then the sampling day would be day 0. If he is fully vaccinated with 2 doses, then on the 6th or 7th day, if a RAT returned negative, it means that the viral load is low and he is close to recovered, and the infection risk is very low. He will not be infected again, so he can resume normal life. Subsequently, if any family members or household members are tested positive, it will not affect the date of ending quarantine. That is the negative RAT sample on the 6th or 7th day. For a household close contact, the clock will start on the sampling day of the family member, that is day 0. On the 6th or 7th day, if the family member is fully vaccinated with 2 doses, on a negative test, he or she can resume a normal life. However, if another household member tests positive subsequently, then the home isolation day will count anew. Then on the 6th or 7th day, on the negative test, he can resume normal life as well. Now, Dr. Lee, please. In the hospital authority, we have 6,698 patients in our public hospitals, North Lantau Infection Control Center, our CHP's Infection Control Center, and the AWE treatment facility. In the Penny's Bay isolation facility, we have 720 patients. As at last night, we have reported 78 patients in critical condition. Among them, 52 have not been vaccinated at all. And 116 patients are in serious condition. Among them, 64 are not vaccinated. As at 12 a.m. today, in the past 24 hours, 144 patients passed away because of the COVID. 85 males and 59 females, ranging from 42 years old to 102 years old. 56 patients were from residential care home, 124 have no vaccination record, 10 received 2 doses, and 10 received 1 dose. Among the 144 deceased patients, 134 were elderly people above age 65. There are 8 patients who passed away, who are of a relatively young age. First, a 44-year-old male. He lived in a care home. He has a chronic disease, and he is not. He has a reduced mobility. On the 27th, he was sent to the Cuomo Hospital. He had a fever and a shortness of breath. He was given intubation, and he passed away in the morning of the 2nd of March. The second patient was a 42-year-old male. He was a patient in the Siulam Psychiatric Hospital. He was a person with disability. After infection, he was sent to the medicine ward. He passed away on the morning of the 2nd of March. The third patient was a 56-year-old female. She was a care home resident. In the afternoon of the 23rd of February, she was sent to the North District Hospital because of shortness of breath and fever. She was hospitalized, and then after treatment, she passed away on the morning of the 2nd of March. The fourth patient, a 57-year-old female with a cancer background, on the 1st of March in the afternoon, she was sent to the Prince of Wales Hospital on a fever. She was hospitalized and passed away on the morning of the 2nd of March. The fifth patient was a 51-year-old female. She had cancer. On the 26th of February at night, she approached the A&ED of Chang Kwan O Hospital. Her situation deteriorated, and she was confused, and then she passed away on the 2nd of March in the medicine ward. The sixth patient, a 54-year-old male with no medical history. He received one dose of vaccine in January. On the 22nd of February, he tested positive on the RAT, and on the 23rd, in the small hours, he went to the United Christian Hospital's A&ED with fever and shortness of breath. His situation was bad, and he was found to have a pulmonary blockage. He was transferred to ICU and then passed away on the 2nd. And then a 52-year-old male with a cancer history. He went to the Eastern Hospital A&ED on the 2nd of March. He had a pulmonary, and he passed away at 2 p.m. And the last patient was a 55-year-old male with disability, a care home resident. He was sent to the Tuen Mun Hospital A&ED on the 1st of March because of a low blood pressure and fever. He was transferred to an isolation ward and passed away on the 2nd. We want to report 42 patients deceased between 24th of February and the 1st of March because of the delay. They were 26 males and 16 females aged between 53 to 108 years old. In the fifth wave, 1,153 people have passed away in public hospital, and most of them elderly people. In the day past, 564 patients have been discharged. Occupancy rate of our isolation bed is 88.1%. 60 patients were confirmed on screening, and 130 staff members are close contacts. 2,521 medical staff in HA were infected, and 600 have returned to their positions.
Q&A, please identify your organization and please keep your questions short. I'm from Independent Media. I've got 3 questions. Now, first, the guidelines for vaccination of recovered patients, do they have to take 3 doses, and would there be any exemption for them? Another question is for Dr. Choi. Can you tell us the arrangement of cut so that people do not have to hot food from supermarkets? Now, an elderly resident in a care home was sent to AW on the 8th of January, and then he was subsequently returned to his elderly home, and then there was subsequently an outbreak there, and now the elder residents are now stuck in AWE, and they can't even leave their cubicle. Can you give us the details, please? First, on compulsory universal testing. This was announced by the government earlier on, and it was a very important means to help us to achieve the zero infection policy. Now, because this is a major operation and the whole territory will be involved, and therefore planning must be very carefully done. The C has said that it must be very thorough, very efficient, and must be done within a very short period of time. We understand that there may be some restriction on movement of members of the public. So we have to plan very carefully the extent and also the details. So there must be careful deliberation before the operation can be launched. Understand that the community very naturally want to know more about the major operation, and the government will, when all the details are confirmed, announce to the public and give the public sufficient time to do preparation on this basis. And then in the past few days, the government has announced that with the assistance of the mainland, we must have a sufficient and stable supply of fresh produce, and the supplies will be sent to Hong Kong by sea, by rail, and by road, and there is no need to engage in panic buying and to hoard up food. Vaccination for patients, for ex-patients. Well, under the CHP, we have the joint committee, scientific committee, and also advisory panels for the CE. From time to time, they review latest scientific evidence in deciding the number of doses to be taken, and also the time gap between two doses. The joint scientific committee will review the actual circumstances and see whether the third dose has to be advanced. When the joint scientific committee has evidence, I'm sure there will be a discussion and a decision. Next. What about Asia World Expo? I think the isolation facilities for the elderly is very different from our community isolation facilities, and that is being taken care of by the SWD, and I don't have any information. I'm from Orange News. A question for the hospital authority. The Chinese university plans to provide 24 beds for COVID patients. I'd like to know the criteria for transferring COVID patients to the hospital run by Chinese university. Now, I understand that public hospitals have got freezers to store corpses. I'd like to know the number of such freezers ordered. Mainland experts have arrived in Hong Kong for a few days. I'd like to know, after exchange with our own people, do they have any recommendations or advice for us, please? The Chinese University Hospital, they have intention to receive some COVID patients to relieve our pressure, and preliminarily they plan to provide 24 beds. As regards the details and patients to be admitted is still under discussion. We hope that the operation can start soon, but we believe patients with mild symptoms will be included. Now, we are grateful to the Department of Health and FVHD for expediting the transfer of corpses to our public mall. Now, as for freezers, we have got a few dozens. Our suppliers will install them in public hospitals as soon as possible. I believe some public hospitals have already received such freezers? Dr. Choi, mainland experts include experts in epidemiology, and also some in treatment. The exchange process is still in progress. They have very close liaison exchange and visits and discussions. After the process is complete, I'm sure they will hear from them new measures. Next question. I'm from cable TV. Now, for the 54-year-old who passed away, he did not have any history of chronic illnesses. Could it be some underlying disease like obstruction of pulmonary artery? Is it a common disease, and is it related to COVID at all? As said by Dr. Choi, there is no confirmed timetable for cut yet. But there is news that close to 500 testing points will be set up. Will it be like polling station arrangements for local elections? Can members of the public go to another district for testing? And it is suggested that there more than one sample can be mixed together for PCR tests to boost the testing capacity. I'd like to know whether the government is minded to accept this mixed PCR testing method. And as for RAT kits, there are different types available and brands available in the market. While the government website has listed a few, but there are many information from overseas websites. Would the government tell us specifically RAT kits that are certified or acceptable for use? According to some manufacturers, when there is the CE logo, that means the brand is accredited by EU. Can you confirm whether that's the case so that people can be more confident in using these? And as for cut arrangements, will there be barrier-free access for persons with disabilities? Now, for the 54-year-old man, he was suffering from diabetes and hypertension. But then he was much better. He was able to do his self-care, and he was comparatively more healthier. He arrived at the A&E department of United Christian Hospital. He was presented with fever and shortness of breath. His condition was not good, and on examination is found to have obstruction of his pulmonary artery, and then he was admitted. Whether his condition was related to COVID, I don't have further information now. Regarding cut details, I think the reporter asked for really operational details. I'm sure that's close to the heart of the public, but I have no more to add at this moment. When the details are finalized, I'm sure the government will make announcements. As for mixing PCR samples, I think the Department of Health can supplement later. Now, in the whole testing process, whether we all talk about sampling and laboratory analysis, all methods have their pros and cons, and the methodology to adopt would depend on the whole workflow.
Dr. Au, there are a number of different brands of RAT in the market. We advise caution when procuring RATs. You should procure those brands with good reputation and track record, and also you should strictly follow the instructions in the kits to arrive at a reliable result. RAT kits are a kind of medical appliances. Under the Department of Health, we have a registration system. There is a platform for registration of such products. And there are also overseas standards on RATs, including standards in the mainland, the National Health Commission, and also the European Union and the US authorities. The public should buy up to standard products in performing tests. Whether we would adopt the mixed sampling or mixed sample testing in the universal community testing, we will discuss it with our experts. The benefit of a mixed test is that, say, if 1 in 5 samples is positive, then we will approach the 5 persons again and take sample again. So whether it is an efficient way to perform the mass test, well, it depends on the number of patients in the community. If a high percentage of the community is infected with the virus, then it may not be very effective. So we have to discuss it with the experts further. Sorry, the speaker is not coming through the mic. So what about the sign, the mark CE? Does it mean that it is reliable if there is the CE mark? I don't have any information on that.
Good afternoon from the SCMP. Can we get an update on the number of people who reported rapid test positive so far on the CHP's current platform for contact tracing? And how many have been counted in the total COVID case tally? And second question is, when's the rapid test registration platform going to be available? And for those rapid tests who tested positive on the earlier platform and reported it, do they need to register again? And is there a risk of double counting? Thirdly, has the Department of Health's lab seen any mutation in the BA.2 Omicron cases in Hong Kong? Because Professor Lau Yulong said earlier he was worried that a mutation may be the reason for children dying. Thank you.
So could you repeat your first question?
So can you give an update on the number of people who reported that they tested positive on a rapid test on the Department of Health's current platform for contact tracing, and how many of those cases have been counted in the total COVID tally in Hong Kong? Thanks.
Okay, thank you for your questions. So far, the number of confirmed cases we announced every day, so far do not increase the number of positive tests tested through the rapid antigen test. We will launch an online platform for persons tested positive by rapid antigen test to report their information to us, and our information technology colleagues as well as colleagues from the OGO is working on this platform and will be launched in due course. So before the launching of this platform, currently all the confirmed cases, we only count the cases tested positive by RT-PCR, but not including the RAT. But we estimate that there might be hundreds of thousands of people tested positive by RAT, but we could not obtain that information at this moment. And according to our communicable disease public interface, some people tested positive. They have reported their information to us through this online platform up to a few thousands, and we have sent SMS to them to advise them that if they are tested positive by RAT, then they need to observe they need to be isolated at home. And when the online platform is launched in due course, we will send SMS to inform them and request them to submit the information to us. For the mutation, the Public Health Laboratory Services branch has performed the whole genome sequencing on the fatal cases, including a children die of COVID-19. And it was found that the virus belongs to the main circulating strain of Omicron BA.2 in Hong Kong, and there is no significant mutations that lead to increased severity. And the Public Health Laboratory Services branch will continue to closely monitor the severe cases and also the fatal cases by whole genome sequencing to see if there is an emergence of any new strains. But so far, all the results show that the strains currently circulating in Hong Kong is still Omicron BA.2 without any significant mutations.
Okay. Platform would be available this week earlier, but now you changed to in due course. So does that mean we're not getting it this week?
Our information technology staff colleagues are working on the platform, and it will be launched in due course when the work is completed.
Okay, one more English question. The one, yes, in gray.
From the Associated Press, could you please provide us an update on the bottleneck in dealing with dead bodies in Hong Kong that you mentioned earlier this Monday? Thank you.
I think the situations is because of the COVID and also the cold weather, and there is an increase in the death. Okay, and after that, the logistics of handling the corpse in Hong Kong public hospital will be the patients pass away in the emergency department will be kept in the public mortuary, and also the hospital mortuary will be kept the patients pass away in the hospital ward. Now, because there is a rising number of the patients pass away in the emergency department, and that's why the hospital have to use up their own mortuary capacity to hold up some of the corpses. And the bottleneck will be, one, will be the transfer. Second, will be the capacity of the public mortuary as well as the hospital mortuary. So now we have to deal with it with more refrigerated container in the hospital. And also, I think Dr. Au mentioned in previous day about how to increase the capacity of the public mortuary.
好，下一個提問，右手邊尾二嗰行最右手位。
Next question, please. Good afternoon. I'm from Mingpao Daily. Now, Dr. Lee mentioned about the 54-year-old relatively healthy patient who passed away at the UCH. When was he admitted? Was his cause of death the pulmonary artery blockage? Is it related to COVID? And you mentioned that more than 1,000 have passed away during the fifth wave. Did the deceased patients pass away more quickly after the onset? And was it because of the delay that there was a delay on their behalf as seeking medical assistance? And how many wards will be converted to receive COVID patients? And what about the air exchange rate after the conversion? Now, what about the oxygen supply and oxygen stock in public hospital at Daily? Is there a shortage of oxygen supply? And we have received complaints that the Caritas Medical Center has no dedicated ward for patients requiring renal dialysis, and they had to perform that outdoor. Is that true? About the 54-year-old male, he was admitted to the UCH A&ED on the 23rd of February. Like I've mentioned, the case has been passed on to the coroners. So I am not in a position to comment on the case. About seeking medical assistance at A&ED, those patients who approach A&ED, some are more urgent, some are not, so I cannot comment on any specific case. In terms of ventilation, we are installing fans or ventilation facilities in the general ward to take in COVID patients. There is not a specific percentage, but we will do our best to increase the number to take in serious patients. Installing fans can enhance the air exchange rate. We would maximize the air exchange rate plus the fans to ensure that the airflow is inward rather than outward to the corridors. On oxygen supply, because of the surge in cases number, oxygen demand is high. Still, our supply is sufficient. There is no shortage of oxygen tanks in hospitals. On the other hand, some patients are staying in wards with no central oxygen supply. So we are sorting out the issue. For the Caritas Medical Center, there are 2 patients requiring renal dialysis. Now we need dialysis fluid to perform the procedure. The normal practice is the patients would be seen by specialists, and the procedures would be performed if necessary. We have changed the dialysis fluid for them.
Next question. I don't have such information with me. The lady on the right. I'm from Tai Kung Pao. Dr. Choi, some private hospitals are not willing to admit confirmed patients. And patients may have to pay $80,000 to $100,000 per day for boarding. What is your comment on that? I'd like to know what private hospitals you've discussed for admitting these COVID patients, and roughly how many beds will be provided, and when can the scheme start? And will patients have to be transferred through public hospitals? And will the fees and charges be similar to that of public hospitals? And do patients have to pay a deposit? And do they have to settle the bill on a day-to-day basis, or when they are discharged? I'll take the first question. There are 13 private hospitals in Hong Kong of a different scale, and the smallest may provide less than 100 beds, and the largest over 1,000 beds. They play a very important role in our healthcare system. Well, in the 5th wave, when there is a tremendous pressure on the public sector, of course, we're pleased to see if the private sector can help, and they can help in many aspects. For instance, they can accept non-critical and non-confirmed patients from public hospitals to make a way to relieve some of our beds. And I understand that some public hospitals are discussing with private hospitals to see if they can accept patients with confirmed patients with milder symptoms, because some patients may just have fever, and they might have done an RAT, and they would like to consult the doctor and get some prescription. And I think such services can be provided by private hospitals. We have discussed with them, depending on their hardware, the age of their buildings, and their infection control measures. They may not be of the same standards as public hospitals. There is a public-private cooperation scheme between the public and private sectors, and perhaps the private sector can accept some patients. The private hospitals have been helping us. We're grateful to Li Ka-shing Foundation Fund, which has donated to 5 private hospitals to treat cancer patients. Those are suffering from colorectal cancer, etc. And then some non-COVID patients requiring rehabilitation services have been transferred. And in the past week, over 70 patients have been transferred to 7 private hospitals for treatment. We will continue to liaise with private hospitals. As for COVID patients, as mentioned, the Chinese University Hospital is going to accept these patients. We will work out the details with them later. The gentleman over there. I'm from AM 730. Regarding the RAT platform, I'd like to know whether the target date of commissioning is no longer this week. And can you estimate the flow and the volume of the platform when it's first commissioned? And I'd like to know whether you have already cleared the backlog of patients at A&E departments. Now, for RAT kits, you ask us to purchase them from reputable sources. Now, if members of the public have already purchased such RAT kits, substandard RAT kits, and if they've been tested positive, what should they do? Should they do it again with another brand, or can they just move around in the community? And I'd like to know whether you have the number of COVID patients not staying in hospitals. I understand that there might be outbreaks in some wards but not announced. I'd like to know the criteria for an outbreak in a ward. And for the medical staff that are there, will they be given an allowance? Because they are also treating COVID patients there as well. Yes, the pressure on our A&E departments is very great, and there are patients waiting to be admitted to wards. We are using various means to alleviate the burden on A&E departments. First, as mentioned, we are opening up new wards as far as possible. Some general wards will be converted to COVID wards. Besides, we will arrange for these patients, if suitable, to suitable community quarantine or isolation centers. For instance, elderly patients will be transferred to AWE, and for healthier patients with mild symptoms, they will be referred to community isolation facilities. I don't have any figures when it comes to COVID patients not staying in isolation wards. The last question. Outbreak in wards. Now, we have a number of factors to decide whether people are close contacts or not. We consider the prevailing environment, the distance, and also whether procedures were taken.
On rapid antigen test, when the platform is launched, we don't have an estimation how many people will register. But we believe that the number will be in the tens of thousands or even more. At present, we are confirming cases on PCR tests. Every day we have more than 50,000 cases. So we believe that given the widespread usage of RAT among members of the public, there are a high number of people testing positive on PCR, and also some 2/3 of patients are presented with symptoms, we believe that for people with a milder symptoms or no symptoms, they haven't received a PCR test, but they have tested positive on RATs. So we believe that there will be a high usage for the platform, more than 100,000. The traffic will be very high. So for people who are tested positive on RAT subsequent to the date announced by the FEHB, you can also register on the website. After the launch, we will also approach the patients who are not registered yet. And also, we urge members of the public to report to us once you are tested positive. Currently, our IT colleagues are working full steam to prepare for the launch of the website. There are some complicated technical issues that they're dealing with. Since we expect a high traffic for the website after the launch, we hope that there will not be any major technical issues causing inconvenience to the public after the launch. We recommend the public buying brands of RATs with good reputation. Currently, the brands available in the market are the major brands, so they should be fine. If you have any doubts on the products, I suggest I suggest you not to use the kits and check the internet to see whether the brand is a reputable brand locally and overseas. If you discover that the brand is not up to standard after the test, then I recommend you do another test with a reputable brand or do a PCR test to confirm the result. Next question, the lady in white. Hi, I'm from Now TV. According to some members of the public, they have made an appointment to get jabbed, but unfortunately, they are confirmed to be infected. So are they still suitable to get jabbed? And also, after recovery, will there be a period that they are immune? So how can they fulfill the requirements under the vaccine pass? And also, we know that there is an outbreak among prisoners. So do we have outbreaks in prisons? Is it possible that the correctional services staff are bringing the virus into the prison? And what guidelines would you what advice would you give to the Correctional Services Department? And about the HA, 60 patients were tested positive in public hospitals, and then they were transferred to a public hospital. So is there an update on the number? Besides the patients requiring renal dialysis, and what kind of patients do we have? Given the shortage of bed, can they do public hospitals have space to take them? And what about the public-private partnership to receive patients with mild symptoms? Now about the shortage of oxygen, is it true that there are 4 patients sharing the same oxygen tank? And what about what do you mean by that? What do you mean by saying that you are resolving the issue? Does it mean that you are procuring more oxygen tanks? I will take the first question, and I will invite Dr. Au to supplement. Whether recovered patients or patients confirmed should get jabbed or when there are requirements specified under the vaccine pass scheme. Depending on the developments of the epidemic, we will adjust the advice on vaccination, and we are waiting for the for further advice from the expert committees. in terms of a vaccine pass, there are two kinds of checking: active and passive checking. For passive checking, it is easier. When when a recovered patient is being subject to a passive checking by a law enforcement officer or an authorized person, that would be a valid reason. And also in terms of the medical certificates, there is not a particular kind of medical certificates for exemption under the vaccine pass that you are a recovered person. So we recommend handwritten. We also accept a handwritten medical certificate for recovered patients. Dr. Au? For patients in a community treatment or isolation facility, that would be approved for them. Some patients received a message notifying them of the infection. Because of the lack of space, they were not taken in to these facilities. We are going to make arrangements for these patients to issue them with a certificate that they are recovered. And then under the vaccine pass scheme, it can show that they have been infected. About cases occurring in correctional institutions, we have maintained a close liaison with the Correctional Services Department. So far, more than 400 persons under incarceration were tested positive on PCR or RAT. For these cases, they are under isolation in the institutions. Inmates who are also close contacts are also under isolation. We have advised thorough cleansing and isolation arrangements for them. These patients are being cared for by medical officers in the institutions as well as the HA. If the situation deteriorates, they would be sent to hospital. For patients requiring renal dialysis, if they are confirmed by a private institution, they would be transferred to public hospital to perform renal dialysis. I don't have any updates on the number. Now, our isolation facilities are very limited. For people requiring a blood dialysis, well, we want to provide them with the services they need because we have a more capacity now, and we are increasing the number of our equipment. So these patients can go to our designated spots, and then we will provide dedicated transport to take them to public hospitals to receive the service they need. Because of the surge of patients' number, in some wards, there is no central oxygen supply. That's why we have to use oxygen cylinders. The restocking of oxygen cylinders involve some logistics process. That is what we are doing now.
Last two questions. That one in the back row.
What do you make of the decisions by some private hospitals to transfer kidney patients to public hospitals? Do you think it was the right thing to do? And why can't private hospitals take in more COVID patients? And regarding plans for the universal testing program, does the government have a rough timetable for it? And will it be carried out this month or next month, as some experts proposed? And is the government inclined towards allowing people to buy food and take away during the testing program? And also, can you give us a little bit more details about the reported outbreaks in prisons and how many prisoners have been infected and how many correctional staff have been infected? And are these people being isolated right now? Thank you.
Well, thank you for the question. May I answer the second question first? About universal compulsory testing exercise, I think it's a very important exercise for Hong Kong to trying to curb the current wave and to reach the 0 case target. Of course, it's a very massive project which needs very detailed and careful planning to achieve its purpose in an orderly manner. So our chief executive has repeatedly explained and reassured the public that the plan would, of course, be implemented carefully and also addressing the need for Hong Kong on the whole. For example, to address its role as an important financial market, to address personal needs to get medical attention or daily supplies. So that sort of detail will be announced in due course. And about the role of private hospital in carrying different types of patients and also including patients which may have been infected with COVID. So we, of course, very welcome private hospitals to play a part in the entire healthcare system in this current fifth wave, whether it's in taking part of in the caring of non-acute and also non-COVID cases, taking over some of them from HA so that the capacity in HA can be shifted to care for the more severe cases and also COVID patients. And of course, the other angle is on outpatient care because many people with, say, mild symptoms such as fever, diarrhea, or they have a self-test RAT positive, and they just want a very simple medical consultation and simple medication. So I think, and I know, the private sector is going to discuss how they're going to go about to help in this aspect. Thank you.
About the kidney patients, we used to have a very close relationships with the private hospital in delivering the cares for the kidney patients. We look forward for more help from them to ease our pressure at the moment. And as I mentioned yesterday, we hope that the recovered patients, they can be returned to the private hospital for the aftercare. And I think we've been in the communication loop.
Dr. Oh, can you talk about the outbreak in the prison?
For the cases detected in prisons and also correctional institutions, as of last week, there are over 400 cases infected persons in custody under CSD so far, and some of them are tested positive by RT-PCR, while some of them are tested positive by rapid antigen test, and quite a number of cases were detected through the screening by CSD among the persons in custodies, and the CSD has implemented measures to keep these cases in isolation in designated facilities, and as well as arranging quarantine for their close contacts, mainly the other roommates in the same cells, to put them under quarantine in designated facilities so as to stop further or ongoing propagations inside the prisons. And also the CHP has been in close liaison with the CSD in implementing prevention and control measures inside the prisons, and we have provided infection control advice as well as advice on quarantine arrangements for the affected persons in the prisons. And I understand that the CSD has also implemented some further measures to prevent persons from bringing the viruses into the prisons, including regular testings for their staff, as well as stopping the social visits at the present moment.
好，我哋仲有一個提問，右手邊尾二個行。你好啊。
Last question. I'm from HKO1. it's been reported that for private hospitals to receive non-COVID patients, there are conditions. For instance, a negative test result within 48 hours, and to ensure that patients can be discharged within 2 weeks. I'd like to know whether there are indeed such conditions. If so, what is the success rate of a referral from a public hospital to a private hospital? We appeal to the private hospitals to accept more non-COVID patients and not to impose such conditions. In fact, private hospitals collaborate with us in many different ways, and we have over 70 patients transferred to private hospitals. As I said, there are patients requiring aftercare. Of course, we very much want and welcome private hospitals to do a bit more to help us. The HA headquarters has got a specific platform to discuss with private hospitals. Thank you very much for your attendance. Speaker is off mic. We're doing that. We haven't got a specific date.